Hello, my name is Dario Gigena. Thank you, Dr. Fatima, for this kind invitation. It's an honor uh, being here. And congratulations for this Congress. Okay, my presentation for you today is strategies, family-based strategies to enhance treatment outcomes for addictive disorders. I'm from ISAM. I'm actually the representative of ISAM in South America, and I live in Argentina, specifically in Cordoba. Today, I will present about this, the background of this issue, the evidence that we have, and an example of implementation. The present scenario of substance use disorders treatments in general, as you may know, substance use problems must be addressed to reduce harm caused to individuals, families, and communities. That is the emphasis in families that I want to share with you about this document. We have a lack of sufficient services for families and the application of evidence-based practices, and only one in 11 people with substance use disorder had been in treatment. The United Nations published this survey in 2022. And we have also a lack of trained staff in the substance use disorder treatment field. What is the concept of family for therapeutic interventions that we use? Anyone who is instrumental in providing support, maintaining the household, providing financial resources, and with whom there is a strong enduring emotional bond may be considered family for the purpose of therapy. And another definition is a group of people with common ties of affection and responsibility who live in proximity to each other. But for the purpose of this presentation and my particular vision of who is family for this approach is actually the influence. Who is influential? Who has influence for the patient? That is considered family for this approach from my point of view. Why involve families in management of substance use disorders? Family dysfunctions can precede substance use or develop as a result of substance use, and family needs help. Unaddressed family issues can act as a barrier for recovery and trigger relapses. Interventions reduce conflicts and violence, improve communication, and increase cohesion. Family strength can add to the recovery capital for the person. That is the reason why we have to involve families and that support the idea of this presentation in this Congress. The effectiveness of family interventions in substance use disorders treatments, we have not as much studies in comparison of other approaches, but we have enough evidence to support the need or the relevance of this kind of intervention in treatments. Involving families facilitates treatment entry, increases treatment retention, and reduces relapses and improve family and social functioning. And the cost of family therapy to treat this kind of problem was lesser than individual and mixed therapy because the outcome, if the outcome is not well enough, probably the cost is higher than adding this component to the treatment of the therapy. Addressing family dysfunction can act as a preventive agent and dissuade substance use of other family members. all here we with experience in the field of the treatment of substance use disorder can support this idea. A little bit about history. One of the first or most influential uh, approaches for families was uh, Narcotic Anonymous, or sorry, there is not anon family groups, but first was here. You can see Lois. She is the wife of the famous Bill W., the founder, the co-founder of Alcoholics Anonymous. As you probably know, she received other wives in her house during the first meeting of AA, Alcoholics Anonymous, in Akron, and that was the pillar of Al-Anon or Alatin and the future Naranon family groups. I want to emphasize other influential method for family therapy or family intervention that was called the Johnson model or family intervention. You probably are familiar with this because it became very popular after the famous, I think the most famous family intervention that was made in the presidency of Gerald Ford in the United States, because his wife, Betty Ford, she suffered by alcoholism, and it was a scandal, a big problem for the administration, and the Dr. Johnson provided his services with the intervention, and she um, recovered actually after this intervention and after this treatment, and she was a very important disseminator of the approach and other approaches, evidence based for addiction treatments. And after that, we know those approaches regarding codependency. Um, I don't want to go further than just the titles, Codependent No More, about the famous book of Melody Beattie, and Women Who Love Too Much. And not far from our team, Dr. Mark Galanter, who was ISAM founder, member, and a very important part of ISAM, created the network therapy. And as you probably know, a smart recovery method incorporate a component for family and friends that is a very important approach with evidence. And the last one that I want to share with you and this overview is the craft method that was made by Dr. Mayer and Dr. Smith, and that is the approach that I want to share with you today. How can we deal with the refusal to enter treatment? As a resume, the first approach of Al-Anon or Nar-Anon meetings is loving detachment. They, as a family, they recognize the powerlessness and focus on their own needs, and unable to stand by and do nothing. That is the most important approach, to stay, to, to focus on yourself as a family member and to be compassionate of the problem of the other person, but nothing in particular that influence to the patient, to the loved one affected by alcoholism. Instead, focusing on her or his own need as family. And the second one, as in this overview, is the confrontation method, Johnson Institute intervention. 3 to 4 rehearsals to prepare family for a surprise meeting to express concern about damages, confront and state need for treatment and negative consequences that will follow if treatment is refused, and reluctance, hide, uh, and most fail to follow through because this method based on confrontation was very, as we all know, very famous in films, in TV programs, but or realities too. Um, and I have to confess that um, it is a very important tool, but we have another good options um, without this level of confrontation or surprise or something that is not as effective than other approaches. Like, for instance, uh, working with family to motivate clients before, um, that is called craft, community reinforcement, and family trainings. That is a joke, but I think it's very important to illustrate that we have been um, treating. That is sad, isn't it? And he won't admit he has a problem. That reflects the isolation that could be a problem with approaches of, for instance, Al-Anon, uh, and of course, it's a great approach, but it's not enough to push or to help the patient to get into treatment, for instance. And the family intervention is too rude, too brutal in terms of the new concept of compassionate approaches, or the modern concept of human rights, or the importance of the cooperation of the client. And there's a joke illustrating this. It's some new thing called an intervention. This joke is very illustrating in this regard. Okay, other evidence-based family therapy practices are designed for this kind of treatments, and to incorporate treatments to the substance use disorder uh, treatments in general. And I want to share just the name on this slide, because I want to move forward to the specific approach that I want to share with you. That is craft. But it's not the only one, and we have many options for therapy interventions, therapy management of the family. Community reinforcement and family training craft works with parents, spouses, partners, or siblings. We call them concerned significant others who meet with the client at least 3 times a week. That is the criteria that they use, as I told you before. I do prefer to understand the level of influence with the client, and not only the frequency of their contact with them or with the client, or in this occasion. We have 3 main goals. One, improve the quality of life and functioning of the concerned significant other, to reduce loved one substance use, or engage loved one in treatment and support. That is a very important consideration, because one important aspect is, of course, to improve the quality of life and functioning of the significant, of the concerned significant other, but also it has a very, very important role in, or crucial, the priority is also to influence to the patient, to influence with the person with the substance use disorder in a very, very important way. As I told you, it was developed by Dr. Meyer and Dr. Smith. You can apply this method in outpatient settings, one-to-one or group settings, used with different or applied with different ethnic groups and substances. Um, the terms identified patient, IP, or concerned significant other. The effectiveness is very interesting to share with you that the, the, the facilitating treatment anti of treatment resistant person who do not want to start a treatment or a consultation, compared with the Johnson intervention um, is 74%, and the rate of the entrance of after Johnson intervention, family intervention is 55%. Uh, Sorry, that is a mistake. With this method has uh, from 55% to 74% higher rate of entrance to a treatment in comparison with Johnson intervention that is only 30%. 70% refuse to enter treatment after an intervention. And even lesser, the Al-Anon facilitation in this study. Enter treatment after 4 to 5 sessions, so it's not a long time therapy, or just with only 4 or 5 sessions you can help the patient or effectively involved to a treatment. Improve functioning of family member by reducing depression, anxiety, and anger, and increase well-being of family member even if substance use disorder affected person did not accept treatment or access to the treatment process. So it's a win-win process in this point of view. Needs little training, only 2 or 3 days, and supervision to be implemented. That is the advantages of this method. The components of craft are the function analysis oriented to the analysis of the behavior of the concerned significant other in relationship of the behavior of the patient. It emphasizes communication skills and role plays to change the communication barriers or problems. One important component is reinforcement, or to help to the family member in treatment to reinforce so their behaviors, to learn what behavior they have to reinforce, remove the four techniques, the four components is remove reinforcement for using behavior. That is an important component. It's not an innocent approach on this regard, because it emphasizes also in not reinforce consumption or other problematic behaviors. The other component is problem solving, because of course it's very usual that a lot of problems emerge, and we need to provide the family member to have options to cope with these kind of problems that are very, very common. And the self-care, as I told you before. And the last part or last component is how to offer treatment to a reluctant family member with substance use disorder uh, in order to effectively involve to a session, a first session, or a treatment or evaluation. On regard of functional analysis of substance use by family member, we have to identify external and internal triggers. That is the common thing about functional analysis in general. I will show you just a simple frame or in order to facilitate the family member to feel this or to complete this information for the use for this therapy. And it helps family members and therapists to understand positive consequences of substance use by the patient, either identified patient that is not in the treatment yet, recognize substance use impact in each area, and manage high risk periods of substance use and violence, and finally identify if the concerned significant other unintentionally supports substance use, of course, with in an unconscious or way, or because they do not know they are not helping. On the contrary, with this kind of behavior could support substance use of their loved one. The roadmap of treatment is the functional analysis, and as this is the frame, we can use this kind of tools in order to facilitate the, the completion of this information in order to planning a better approach or a specific approach for this patient. External triggers, internal triggers, what is the consequence of the problematic behavior, like in this case drinking or using, and the features of this behavior, and the consequences, like the positive consequences and on these topics, or the negative effects on these topics too. The second one was we have to support the concerned significant other to list positive reinforcement to reward the identified patient when substance use is not used. That is a very important concept, and that is something too important for a priority. We have to start with this. In other approaches, we have to start with for instance, to not supporting problematic behaviors, or to avoid contact or confrontation. But in this case, it starts with the identification of positive moments when the patient is not using, or his behavior is doing something beneficial for the treatment, something that compete with the substance use or the problematic behavior, something that compete, something that produce a reduction of or interruption of substance use or other problematic behaviors. Rewards need to be easy enough to give frequently. That is an important requirement of this concept component. We have to give it frequently within their control, to give with the control of the family member that is in treatment. The link between rewards and not using substances must be clear. I like to spend time with you when you are sober. That is an example of this idea. As an example, other example is uh, spending enjoyable time with the identified patient, complementing, preparing a special meal, discussing a topic that the identified patient enjoys, watching a movie together. There are examples um, on this component. It helps the identified patient recognize that one can have fun even without substances, increasing positive feelings. There is an important idea that I want to emphasize about this method, the importance of the identification of those behaviors that are positive, that are, as I told you, that help to reduce the substance use or another problematic behavior by the patient, and to systematically uh, give support or to reinforce uh, through the family member in order to provide this kind of reward to the patient. Why should I reward sober behavior? Because it's simple. Increases not using behavior, potentially decrease using behaviors, and create positive experiences for the concerned significant other and the identified patient. That is a very important tool, as everyone knows. But it's not bribe or some kind of manipulation to my loved one. It is not, because a bribe comes before the desired behavior occurs and is a coercive action, typically to benefit the patient who is bribing. The benefit of the main benefit is for the patient, is for the person, sorry, who is bribing. uh, the bribe to a policeman is just to benefit first, the first beneficiary of this bribe is the driver that is doing something wrong. A reward comes soon after the desired behavior occurs and typically benefits the person engaged in the desired behavior. That is an important definition. And another definition is as a difference between 12 steps and craft. As this sentence says, remember, when taking responsibility for our own behaviors, each one of us must find our own path. Experience teaches us that it is useless to lay out the path for someone else to follow. We must each make our own way to our goal. That is the difference that I emphasized in the first slides regarding 12 steps approaches. We want to influence rewarding sober behaviors to the patient, and a difference between enabling versus rewarding. Enabling is an action that by the significant, the concerned significant other, that unintentionally increases or allows drinking or drug use to continue. For instance, shielding the identified patient from negative consequence of using. For instance, calling in sick for the identified patient who is hungover, and rewarding is an action made by the concerned significant other that increases not drinking or not drug behaviors. For instance, intentionally, and mindfully rewarding non-using behavior as an objective of the treatment in a session or in several sessions. That is an example. offering to make dinner for the identified patient who comes home directly from work without using or when reduce the consumption or when they reduce or interrupt the problematic behavior. What makes a good reward? The identified patient finds it rewarding, is free or inexpensive, is immediate or with no delay, is comfortable for the concerned significant other, and the easiest reward is positive verbal comments. Say something nice for the patient, but in this specific moment that we have to reschedule with the patient. What moment, what kind of behavior, and when, what we have to do for this kind of reinforcement. And potentially more effective rewards are those with emotional impacts on the identified patient, saying, as I told you, saying something good but with emotional content. And the ideal reward are those that competes directly with drug or alcohol use. The third component is this concerned significant other permits negative consequences of substance use to occur instead of being an enabler. I think that not only negative consequence, but also the term of natural negative consequence. That is different to a punishment concept. Not make excuses for absence, for family gatherings, not giving extra money to pay the bills and compensate for the money spent on substances, not cleaning up if the IP, for instance, vomits or throw things around to help um, with this kind of problem. Helping the patient with this kind of problem uh, probably um, reinforce the problematic behavior, and not doing this permits negative consequences, and those negative consequences produces pain, and the pain of using must be greater than the pain to cope the problems and to ask for help and to live without substances. That is a general concept for this idea in general. The concerned significant other may withdraw rewarding behavior when the patient is under influence. For instance, not spending time with the patient and going for a walk instead, or other options, thousands of options. That is a general idea, but the implementation is not easy. And not rewarding using natural consequence, how unintentionally the concerned significant other reinforce drinking or drug use. For instance, calling, as you know, calling in sick for loved one who is hungover, making excuses for loved one's behavior, cleaning up after them when they get sick. We have to explore the natural consequence, negative consequence for use, identify problems with allowing natural consequence to occur, and will likely need to use problem solving and communication skills with the concerned significant others. Another example is the freezing method, freezing without withdraw reward when a loved one is using. The technical name is extinction. Even negative intention can unintentionally reward drinking or drug use. As example, a mother often waits up for her adult daughter, Susana, on nights when she calls out for drinking with her friends. As soon as Susana is in the door, they start to argue. And of course, we have to help the mother of Susana to change her behavior and do something different. Initiates activity to help the concerned significant other feel better, irrespective of substance using person's behavior, revive friendships, raw hobbies. We have a lot to, um, to share about this method because it's very important too, and probably an experienced therapist has a lot of initiative or ideas or examples about this important tool. And provide communication training for the concerned significant other to present messages in a clear manner, express understanding, and respond appropriately, even if the person responds negatively, and invite the person to treatment by using the right opportunity. Communication skills as a resume, be brief, be positive, be positive, be positive, refer to specific behaviors, label your feelings, offer an understanding statement, accept partial responsibility, and offer to help. All those communication skills require a lot of practice, role playing with the therapist on the session. Do not assume that the concerned significant other could apply this just for a discussion on the therapy. We must to be sure that the concerned significant other incorporate these skills in every scenario. Self-care, increasing or utilizing social support and increasing engagement in enjoyable activities, for goal settings, and I would like to share this phrase: walking with a friend in the dark is better than walking alone in the light. Helen Keller. On the last slide, one of the last slide is when craft may not be helpful in current domestic violence or high risk for domestic violence. We have a specific protocol for this. When the concerned significant other has insufficient contact with the patient, or when the concerned significant other are more interested in individual therapy for his or her own emotional difficulties uh, instead of the need to have this loved one in treatment. There is an institution that we implemented a version of this kind of in a structure specialized outpatient program. This is the map, the roadmap for the patient and the family. We have a specific team for families, a specific team for the patient, and we have also mixed sessions for both. And just for letting you know about this, there is an example of a group evaluation of the progress. For instance, the progress of the after 6 months of the patient, of that is the patient, the age, the diagnosis, that is an evaluation made by the family member, the initial status, the current status in the moment of the worship with the family, and the concerned significant other status as a priority too, and the other components of the method that I shared with you before. And those are the references. And thank you very much. Sorry for not being with you this time, probably next time. And congratulations for this Congress. Bye bye.